All right, in this video, we're gonna demonstrate how to perform the manual muscle test for the Sartorius muscle. And the motion that we're gonna test is a combined motion of flexion, abduction, and external rotation, which are all the motions that this muscle contributes to. So I use the acronym FABER to remind myself of those three motions. Okay, so our patient's gonna assume a short sitting position for this manual muscle test. Her opposite limb is supported. So we're gonna assume that I've checked her active range of motion on her left side, which is her unaffected side. We can check now active range of motion on her affected side. So what I'm gonna have you do, Ollie, is kick up just like that with your foot. Perfect, and then come back down. And I can palpate for muscle contraction of the Sartorius. I can either palpate just proximal to the knee and visualize how it crosses the medial side of the knee and attaches to the pes anterior. So I can palpate here and have her do that same motion. Up and in, good. And if you feel like you're not getting a good sense where that is here because the muscle is thin, what I can do is I can feel for the muscle closer to its proximal attachment. Is it okay if I feel just on your hips?
Yes.
Okay. So I'm gonna feel at her ASIS, and I'm gonna come just off her ASIS right there and visualize again the line of the Sartorius muscle. And can you kick up and in again? Good, and it's a hip flexor, so I definitely feel that. So next I'm gonna apply my resistance. This is the tricky part because I need to resist all three motions. So can you kick up and in for me? Good, so my bottom hand is going to push on her lower leg, and I'm gonna push her into internal rotation with this hand. My top hand is gonna come on the proximal thigh. I'm gonna push down into a hip extension, but I'm also gonna push into adduction. So hold nice and strong for me. You're doing great. And hold strong and don't let me move you. Good. So you can see how she gives a little bit. So I would grade that a 4. She's able to tolerate moderate resistance. If there's no give and she's able to tolerate maximal resistance, that would be a grade of 5. If she's just able to perform the motion, that would be a grade of 3. If she can't even perform the motion against gravity, what we're gonna do is we're gonna change positions. So I'm gonna have her, can you lie face up on the table for me and just have your legs straight out? Perfect. And then what I'm gonna ask is, can you put your heel of this right foot on your shin right near your ankle? Nope, so I'm gonna have you put it right on top. Perfect. And then I'm gonna have you drag your heel up towards your knee for me. Great, so she is able to do that. We're gonna call that the gravity eliminated position for the Sartorius, and that would be a grade of 2. If she's unable to do the motion, but I can palpate muscle contraction, that would be a grade of 1. And if I don't feel muscle contraction, that would be a 0.